Subscribe to our YouTube channel and don't forget to press the bell icon to get all the latest updates. The number of COVID infections in India continue to surge. In fact, every 24 hours brings a new record high. But we don't want to be alarmist on this program. In fact, as we've been long arguing, the serological surveys done across 3 cities of Delhi, Mumbai, and Pune clearly show that the infection is in fact already much more widespread than we think. And the corollary is that the infection fatality rate is much lower than we feared. So, while we don't need to be alarmed, there's another conversation that we need to be having and haven't had. What happens after people recover? Is the recovery long-lasting? Is the recovery permanent? Or are there other medical complications that develop that we do not even know about? And how long does your immunity stay once you have antibodies? In other words, is it enough to understand the COVID data by looking at the number of infections and the number of recoveries, or even looking at the serological surveys? Do we need to dive deeper? Do we need to dive deeper and in fact look at what happens to people who recover? On the program today, we have 3 eminent medical voices, Dr. Ambarish Mithal, Dr. Ambarish Satwik, and Dr. Oomen. But most critically, we have 3 people who have agreed to share their first-person stories of how their lives have been after they have recovered. What has changed, what has not changed, because this is what's really going to provide us the learning. Let me, before I get the personal stories, just get a couple of comments from the doctors. Dr. Ambarish Mithal, I'll start with you because you're back to regular practice. You're back to seeing your patients. You're an endocrinologist. Diabetes is considered a major comorbidity that can create complications if you also test COVID positive. After people recover, have you had feedback that they have developed complications that they never had before?
Well, Barkha, I can't really say that they have developed new complications, but for sure, people who seem to have recovered, the worst is over, they're out of the hospital, they don't have fever, all those things, still seem to be suffering a fair bit, especially those people with diabetes who went into COVID uncontrolled. So persistent fatigue, persistent tiredness, brain fog, but even more than that, even the diabetes itself. COVID does a lot of things to diabetes, and very quickly I'll summarize for you. It obviously worsens existing diabetes. Those who are poorly controlled have poorer outcomes, you know that very well. But there also is a fact that you can get new onset diabetes with COVID, which is being investigated and studied very thoroughly. Again, there are 2 types. One is a new onset, just transient diabetes, which happens because of severe stress in any disease. You can get severe stress, can cause high blood sugar, which resolves. But here in COVID, there is a suspicion and there is a feeling and there's an observation that some of this diabetes may actually be irreversible. We don't have a final answer yet, but it's likely or possible that COVID is doing a lot of things to the pancreas, to our overall system. So my patients who've been through COVID are actually, many of them, either it was very light COVID and they had nothing. Yeah. But the ones who went into hospital and took those large doses of steroids, everything, a combination of COVID and steroids is keeping them little unwell for a significant proportion of time. I don't know how long, but it's very, very clear that it's not that they are fine out of hospital and they're gung-ho. There is a problem, they're fatigued, their sugars are all over the place. In some patients, it took me a month to get their sugars back down to baseline.
So we're going to hear these first-person stories in a while, but I'm just wondering if this should change our understanding of whether the worst, when we can say the worst is over. And let me bring in Ambrish Satwik into this conversation. Ambrish, I'm one of those unusual people who, after traveling across India and looking very closely at the serological surveys, has been arguing against the lockdown, believes that people should get back to living, believes that we can't postpone our life indefinitely, and that the serological surveys seem to tell us that this virus is not as lethal as we'd feared. But on the other hand, we keep reading about these stories about people developing complications beyond their respiratory systems, complications that we had not associated with COVID. What are you finding?
Yes, I would like to say that this is one incredibly penetrant virus. It has protein manifestations, and there is a subset of patients where the virus will ravage these patients with a diabolical malignancy. And there's enlarged curiosity about how to identify that subset, but we are unable to do that. But I'd like to mention three specific complications in the convalescent follow-up. One of them is what Dr. Mithal alluded to, which is the chronic fatigue syndrome, which is in technical terms is called the myalgic encephalomyelitis syndrome. Mm-hmm. And it manifests with severe, profound, debilitating fatigue. It manifests with a kind of brain fog, cognitive impairment, unrefreshed sleep, and something known as orthostatic intolerance. And, orthostasis, the word means standing upright. So these patients are intolerant to standing upright. And then all of us realize what an incredible feat it is actually to stand upright, because standing upright is a stress. So it takes, it's an interplay of vascular compensations, neurologic compensations, humoral compensations to counteract the effect of gravity and venous cooling to stand upright. And these patients are unable to stand upright and experience severe debilitating fatigue. So this is the chronic fatigue syndrome that we have to worry about. And of course, there has to be longitudinal dialogue with the patient in follow-up to tell them to manage their expectations and allow them to realize that this is something they might be suffering from.
So before I get first-person accounts in Ambarish Satwik, does this alter your sense of assessing the damage? You see, because the challenge before us is so many ways of life that are on hold, right? Whether it's exams, whether it's schools, whether it's opening offices, whether it's flying again, whether it's so many parts of our economy. And I had begun to believe, looking at the serological surveys, that the virus was not as lethal. Because most people seem to be just asymptomatic, not even know that they have it and have already got over it. But these complications post-recovery, does that make you look at it differently?
So, I'll say that there's a subset of patients that is experiencing these complications. Mm-hmm. And to add two more things, it's residual pulmonary fibrosis, in the patients that have had lung involvement. And finally, vascular complications. These are patients, who end up with blockages in arteries and veins, and sometimes end up with gangrene of their upper or lower extremity, which might necessitate amputation if one is not able to successfully relieve these blockages. So these are the three main complications in the convalescent follow-up that one should be worried about. But to answer your questions, it's a subset of people. It's not everyone. It's difficult to predict which subset this is going to be. But in the first case, the chronic fatigue syndrome, usually the patients who are experiencing some amount of fatigue during the illness are the ones who are likely to end up with the chronic fatigue syndrome. So you have cases who end up in ICUs on ventilators, come out and do not ever experience any of the convalescent symptoms. But there are patients who might have a mild illness, but have fatigue in the primary acute phase of the illness.
So if it happens to you during the illness, you're likely to carry that complication into the post-recovery stage. That's useful, which should mean that if you're asymptomatic, once you recover and you develop the antibodies, you're not going to develop any surprise complications later. I'll get Dr. Oomen on that in a moment. Amit Thapar, if I can bring you in, and if you can talk a little bit about what happened to you after you recovered and how bad your symptoms were when you tested positive.
Right. So I'm 46 years old, athletic. My base pulse is about 43, 45. I run half marathons. Swimmer. I'm doing 200 laps of a 25-meter pool. Totally health conscious. Now, I contracted COVID on 1st of August, and I thought that I would be okay in just a snap. In about 2-3 days, I should be okay. And so I did not get myself tested. From day one, I never got fever more than 99.5. It was 99, 99.5. It would become normal in the evening. No complications of respiratory issues at all. I got my all blood tests done during this COVID period. CRP, ESR, ferritin, everything. In touch with the top doctors here in Ludhiana. Got my chest x-ray done. By 10th day, the cycle was the same. 99, 99.5. In the evening, would come down again in the afternoon. And along with that, what I had was very, I used to get a nervousness in the body, a bit of trembling kind of an effect, uneasy kind of some low current is passing through the body. I would feel very, very weak. Nothing like chronic fatigue in the sense that I cannot get up or something like that, but I just wanted to lay down and, just on 10th day, I got myself tested. I was positive. My CT value on the 10th day was 27. This continued until 14th day, and the doctors would tell me sometimes the fever can persist until 14 days. You don't need to worry. I was home quarantined because I got myself tested late until 26th. I was officially under home quarantine. Again, I got my blood tests done on 17th and even yesterday. And today I got my antibody test done. So even till today, this day 28, my routine is not back. I feel weak. I feel fatigued. I do not feel like I used to walk, 12, 13, 14 kilometers a day. I don't even feel like walking more than 2 kilometers. I tried yesterday 2 or 3 kilometers. I got my chest CT done. My severity score was 3 out of 25, which the doctors say is a very, very mild attack of COVID. But I've got into this cycle of weakness, of fatigue, of this temperature going up till 99.5, coming to 99, dropping down to 98 in the evening before I sleep, 97.5 in the morning. And some doctors used to call it, circadian cycle or something. But my body itself, I can feel that there is something wrong. I'm not the same person I was before COVID. And doctors don't have any answer for this because all the reports are normal.
And let me ask you this, Amit. You had no other comorbidities that you know of, and you had a very, very mild attack of COVID.
Absolutely. If you consider, yes, I have a history of thyroidism. I had hyperthyroidism in 2007. It was over in 2009.
Yeah.
It got converted in 2018 into hypothyroidism. I get my tests done regularly, TSH, T3, T4, all normal. I've got them tested 3 times during the COVID, and now yesterday, again normal. I'm just on a 25 mg thyroxine. So I don't know whether whether thyroidism, mild thyroidism can be considered as a comorbidity or not. I'm not too sure about it. I don't have any diabetes, no blood pressure. My BP is 120, 80. Even during the COVID, I was checking my BP. Everything absolutely fine. But I am completely a different person, and I just want desperately my old life back.
I mean, your story actually tells us how much we don't know even now. And someone like me had to accept it because I've been arguing that the worst is over based on the serological surveys. But it's a wake-up call for people like me who are saying, okay, there's stuff going on here that we don't understand. Before I get the doctors back in, and Dr. John, I know you've been waiting. Nitin, can you share your story as well? Nitin?
Sure. So I'm 37-year-old. And physically active, not as good as Amit, but I used to run in the morning, do all physical fitness and all that. And again, I would consider myself to be a fitness freak. So I got this COVID attack and, got a fever ranging 102, 101, and sometime 99 and all that. So during my entire 15, 20 days, the COVID last, like 10 days fever, and then the fever subsided and I started with the sore throat and the cold and the cough and all that, which lasted for another 10 days. So for the 20 days when I was in this completely room isolation and all that, I didn't had any issue of, like a fatigue or a body pain much and all that. It was just, I had a fever, and because of, not spreading to other people, I just had a home isolation or a room isolation, I would say.
Yeah.
But 2 things I noticed during that time, every day in the morning, and it's very less known thing, but what I saw, that every day in the morning, there was a floor full of the hairs. I would say that why the hairs on the floor? I thought maybe the window or something. I cleaned up on a day. Next day morning, again, huge amount of hairs on the floor. 3rd day also, 4th day also. And after a few days, I saw, they are like, I lost a patches on my hairs. So I Googled it, what is this going on? And I think 55 or 60% people in US and Europe has complained about the same thing. People are coming with a bag full of hairs they are losing because of the COVID. So that was something very, not known for me. Second thing what I noticed was that I lost almost 7 kgs or 8 kgs of weight in 20-25 days. And even after I tested negative, I'm still losing. I've been tested negative almost 15 days back. Now I'm weighing every day and I'm still losing weight every day. And
Do you feel like, Amit, that you're not the same person after
No,
recovery?
not at all. So I was a certified balloonist, Barkha. I was in any parties I would go, I could just blow 50 to 60 balloons in no time. I big balloons. So I always proud of my chest. And everyone was saying, okay, call Nitin, he'll just blow out the balloon for the party. So I'm that guy. And in 20 days of COVID, I never had short of breath. I never had any issue. I got the chest CT scan done. They said there are mild patches of COVID. Yeah. There are white patches of COVID, right? But after the recovery, now I'm short of breath. I walk from my room to a kitchen. I have to stop and, take a breath. So I'm feeling short of breath. But as per doctors, there's absolutely nothing in the lungs. It's a small white patches, but they'll cure in 4 months. Keep doing pranayam, nothing to be worried. So I was now short of breath, and I could hold my breath for 1.5 minutes when I was normal. Now I can do 45 seconds, which is still good as per the COVID thing, but it has reduced to half.
So I just first want to thank you and Amit for sharing your stories. We'll hear from Neil in a moment. Dr. Oomen John, you work in public health, and you have been arguing for a registry that will track patients because you are researching in particular these post-COVID recovery complications, sir. Can you share your thoughts? Dr. Oomen John.
Sure. So right in the beginning, when this whole thing coming up, we kind of indicated that there's a need for us to have a clinical registry of patients who are getting in to hospitals and what is going to happen to them in the long term, because there were reports from other geographies saying that there is this whole immunological kind of syndrome that people are experiencing, and particularly described in children, something called the Kawasaki Syndrome. And there was a couple of reports, quite anecdotally, but there was nothing. And most recently in the UK, actually people who have been having these symptoms have got together and formed something called the Long COVID SOS. So they have formed a self-care group and highlighted this issue, and they've actually got WHO asking, we need to have this addressed as well. So as a researcher, do we really know what's going on? We saying that India is on a tremendous journey of recovery. We have reached 80% odd recovery, but what? Is it really recovery in the true sense of recovery? Just because somebody's testing negative or doesn't have the virus anymore, have they recovered? What about sequelae? So this is something that we really need to understand better.
Yeah.
So that we are able to provide the kind of support.
Right. Sorry. Your line doesn't seem great, but I think I got the essence of what you're saying, Dr. Oomen John, that if we are saying we have a great recovery rate, is it really recovery? Before I get Neil in and go back to Amit and Nitin, I want to get Dr. Mithal and Dr. Satwik on this. Dr. Ambarish, Mithal, you've heard these very moving accounts from Amit and Nitin saying we're not the same people. We don't have the same lives. Now, are you hearing that from a lot of people, or is it like Ambrish says that this is a subset and this is still the exception rather than the norm?
So I do think it's not happening with everybody, for sure. It's not happening with some who were seriously ill too. They come out very well. But the kind of patients that I see who already have probably pre-existing diabetes or poorly controlled diabetes, they're suffering quite a bit. I would say very few of them are really feeling fantastic after recovery. Just the relief of not ending up in the morgue is actually very big. But the fact that they are not feeling okay is very clear. And I'm definitely, even the blood glucose control takes up to a month. So there is a little angle here. You see, the virus does two things. There is a direct viral impact. And then there is the impact of the cytokine storm. We all know that the inflammatory peptides that are released, so both these can actually cross the blood-brain barrier and reach the brain. Now, we do not know what is the residual impact of the virus. That is still being studied. But clearly in other viruses, it's known that if you get a cytokine storm of the extent that COVID produces, which very few viruses do, then it can definitely impact your brain also. So a lot of this fatigue and this low feeling, insomnia, depression, I mean, a lot of it is also based on the environmental stimuli and COVID and, hospital and all those things. But the truth is that patients with diabetes, patients who have comorbidities, patients who have been through a bad time, are not like suddenly becoming all right. I think they're taking pretty long. And what my fear is that the lung fibrosis story Ambrish was talking about, if that really manifests clearly, then we'll in for a really long haul. And the long COVID, as Dr. Sab is saying, that's really a serious consideration.
So here's the point, Dr. Ambarish Satwik. The three men on this panel are young, fit, and without any known comorbidities. I mean, you heard Amit and Nitin, a record balloonist, a marathoner. What do you make of the accounts you've heard? And do you agree with Dr. Oomen, John, that we don't know whether a recovery is really a recovery?
Yes. What's strange about this condition, this chronic fatigue syndrome, which we're talking about, is that it is actually a lot of people believe, people who've been studying this believe that this is a sort of protective mechanism. It's a protective mechanism of hunkering down on the rest of the body so that energy is conserved in fighting the illness and repair. Mm-hmm. What's happened in some conditions, and there are other viral ailments where this goes on forever. In fact, it's called the chronic fatigue syndrome only if it extends beyond 6 months. So technically, we don't know because we're not that far into the epidemic if this can be called a chronic fatigue syndrome. This hunkering down mechanism is not turned off. Mm-hmm. A lot of people speculated that there's like a fatigue nucleus in the brain, which is constantly turned on, there's no way of turning it off. And it's going to take time. And unfortunately, there seems to be no known therapy for this, except a kind of pacing, which is just to pace your activity and your rest in a guided manner. And these patients, which is why the great role of communication, it's not a matter of trifling significance. I think what seems to happen is, theek ho jayega, aaram kariye, pareshan na ho. But as I said, longitudinal dialogue with these patients.
Yeah.
So let me add, Barkha, quickly that this has often been lumped into minor psychological depression basket, and a lot of people do use antidepressants for the so-called chronic fatigue syndrome. So there's a lot of overlap between those syndromes also, but increasingly it's emerged as a clear-cut entity which requires specific medication, of which none is available actually.
And we've also had Nitin talking about hair loss, and they've listed very specific things actually, and not just feeling low. Can I get Neil to come in and join this conversation? Neil, share your story now.
So I'm not going to try and be like anti-alarmist here or just go against the grain, but it's been like 5 months since I contracted COVID. And maybe because it's been 5 months and the psychological and the physiological effects have had the 5 months to gradually disappear, or maybe because I'm 22 and I'm supposed to be someone that like gets it and is asymptomatic, or maybe because when I did contract it in March, the disease was like a relative unknown. Like it was hard to get a test for COVID, and tests when you had COVID were like unheard of. So maybe because of that, I should say that 5 months down the line, I don't think it has made me a different person or had severe health effects on me. Again, I can't medically diagnose myself because I'm not qualified, but I think that like I want to paint a more positive picture here and say that young people like me do have the ability to recover sufficiently from the virus. Also, when I had the virus, I think I had a fever for 3 or 4 days, a dry cough, fatigue. But just like a couple of paracetamols would help me. Like I've had the flu, which has been worse than.
But how are you today? How do you feel today?
So today I feel completely fine. But again, that could be a result. I mean, I haven't done invasive medical tests on myself to have like my lungs scanned or my chest scanned or things like that. So I should say that like I feel fully recovered today. It's just that I knew that this virus was not a regular flu or like a regular infection. Because the fatigue that I had following my recovery lasted for like 10 days, 12 days, 2 weeks, which never usually happens. Like when you're infected with a flu, maybe a couple of days and you're fine after you've recovered. But it was just the fatigue that was
So I'm glad at least someone has a relatively positive story. Amit, of all of the three people that I've heard, you're obviously the most shaken. And did you get told a lot that maybe you're just low, it's the lockdown, it's the pandemic? Do you have doctors who basically don't know what's wrong and will then keep saying you're just low, which could also be true. I'm not saying that that's also outside the realm of possibility. But sometimes when we don't know something, we just say, look, maybe it's all of these other things.
Absolutely not. Lockdown started on 22nd of March. I had started going to my factory on 28th of March. In 6 days, we were operational again. We had huge export orders. My business is doing absolutely fine. I employ about more than 2,800 people in the factory. It's a big organization which me and my uncle run. From that point of view, it never was an issue at all for me. I mean, there was because I was totally active. I mean, lockdown practically did not exist for me. It was just a 6-day lockdown for me. So, I mean, and ample precautions we had taken in the factory. I mean, I was one of the last persons, I thought that I would be the oversmart one and I would get the virus at the end, last 5%. I never used to socialize. I used to, my Saturday evening jog and my 2 bottles of beer. That was my routine. And, because I travel a lot, I used to be out of country every month. Lockdown was a kind of a bliss for me. I didn't have to travel. I was with my family. I had the best of the time, best of the worlds during the lockdown. But now, and I was not hospitalized. My fever never crossed 99.5. I'm so furious that I don't know why. There are people who ended up in hospital from my organization, much severe cases. They are back to work to their normal life.
Yeah.
I mean, a lot of them.
Yeah.
Why me? I mean, it's completely crazy.
What are you not able to do that you could do before, Amit? Give us some examples.
The first thing is that I get this nervousness. I some kind of a low current in the body. For example, if I have to walk fast 12 kilometers or 10 kilometers, I can't do that. I tried yesterday. I went for about 2 kilometers, 2.5 kilometers I did. I felt a bit uneasy. I came back. The kind of active thing I had, of course, I mean, my sleep pattern, even before COVID, was not great. I used to sleep just about 5.5 hours. During the COVID, it was completely shattered. I did not take any antivirals. So doctors have just given me some more supplements and a sleeping pill.
But do they believe it might be anxiety? Do they believe you might be having anxiety attacks? Or, I mean, have they said something like that?
There is no mental anxiety. Mentally, I am perfectly okay.
No, I'm asking you if the doctors believe that you have anxiety. Do your doctors believe that it's anxiety?
No, I have not been put on any anxiety pill. Only a kind of a sleeping pregabalin, GABA something, Eltizam or something, that 250 mg to sleep for 15 days with assurance that it would not be it's not a habit forming drug. Just try it for 15 days, sleep well, let's see.
Right. Dr. John, the more disturbing reports, and we're going to follow this up, is of children, very little children developing complications after recovery, which again defies our assumptions about this virus, which is supposed to leave the young relatively insulated. What are your findings on this, Dr. Oomen John?
So we have really not looked at it at the moment. So like I mentioned to you earlier, it is just an initiative that has just started globally on looking at what are the outcomes and long-term outcomes. So too early to say anything. But like I mentioned to you, there have been reports from the US and some other parts where they are describing something called Kawasaki Syndrome, which is typically an immune-mediated kind of a condition in which you have a lot of these chronic fatigue kind of a thing. So we have heard from the other experts saying that it is probably a mechanism which the body puts across to fight the disease, but then there is no switching off of that. Therefore, it continues over a period of time. So we need to collect better data, Barkat, and we need to understand what is the clinical picture post discharge or post recovery, as we call it, over a long period of time to understand what's going on.
Right. Nitin and Neil, do you want to add to that? And then I'll take last comments. Nitin, your specific example of hair loss, not having the same lung capacity, how has that influenced different things in your life?
See, it does. It definitely, because, for example, and just, in the COVID, we had 2 weeks back, my daughter turned 1. So there was a party at our home. There was supposed to be a party at our home, and I could not do any balloons.
The balloons really does bother you.
It does bother me. But it's not about the balloons. It's about my capacity of my lungs. Because, when I walk from, as I said, from room to a bathroom or room to a kitchen, I feel short of breath. And another thing which I missed out to tell was my ear infection. In my entire age, I never had ear infection in my life, in 37 years. And when I was COVID positive and I was completely in home isolation in a completely quarantine environment, my ear completely swelled and it aches like anything. So I had to use 2 pillows, to keep a gap to sleep on. It was so bad. And when I told my doctor, is it something linked with corona? Then he said that, we don't know yet. We are still researching a lot in which body part it affects. So it could be something like that.
Right. Neil, you said you're young and therefore you're doing much better. Would you be willing to say that, you're willing to live your life normally again?
Well, just knowing that I have antibodies was a huge relief. But again, I'm not sure that we know enough about the long-term complications of the disease and its effects for me to say that, everything's fine and normal with me and will be in the future. But I hope that in the next few years, after we've dealt with the virus, we can have more effective studies to tell us what exactly does happen.
Yeah. So I want to give the last words to Dr. Mithal and Dr. Satwik. Dr. Mithal, let me ask you this. Right now, the big debate, should the NEET G exams happen? Should schools reopen? And the corollary question is, how long can you shut down countries? How long can you shut down lives? Because what if there's no vaccine? What if 6 months from now there's no vaccine? 8 months from now there's no vaccine? How long can we live like this? Is one side of the debate. Then you hear Amit, Nitin, Neil shaken by what they've gone through, right? And you don't want to make light of it, and it gives someone like me pause, and it makes me re-examine my own position. So where do you weigh in on this?
I think first thing is we have to realize COVID, we are in for the long haul. There's no question. So we can't pin our hopes on a vaccine, which is, of course, very much in the pipeline, but you don't know how well it's going to work. So we really it's a cliche, but we have to learn to live with this for sure. So whatever mechanisms are required, they have to be put in place, whether it's NEET or JEE or whatever, because you cannot forever postpone it. I agree with you. Supposing there is no vaccine for next 1 year, which is possible, then what do you do? So we have to find a way out of this. Countries will have to observe more stringent, maybe offensive measures, like classifying certain behavior as offensive, like a seat belt or a helmet, masking maybe in that category. I mean, we have to go ahead with that kind of thing, and we have to learn to live with it. I don't think that we can forever just abandon everything and put it in a limbo. One quick line here: more and more evidence that most of the transmission is through droplets. More and more evidence that just wearing a good mask can reduce a lot, may not take it away. And while fomite transmission is important, it's not that common as it was thought to be. And open air transmission is very rare. So those basics we need to follow, and I think it's important. And of course, as usual, I must say before I close out, is that most patients, most people who get COVID recover beautifully, really well, without any symptoms. Many of them don't even know they've had it, or many of them have symptoms of 1 or 2 days. It's only some who get stuck, and some, like this young man, Amit, inexplicably get stuck, where there's really no logic for Nitin or Amit to get stuck so badly in this. Most of my kind of patients do have a tough time, but they're all gradually, so even if they recover in a month's time, I'm all right. But my fear is we don't know enough. It's going to be there 2 years, 3 years from now. That's the problem.
So Ambrish, Satwik, the hope that one could have drawn from the serological surveys, should we hesitate to draw optimism from them?
No, I think the serological survey will just give you some sense of where we are. there was this very enigmatic phrase that Carl Friston from the Imperial College used, which was, there's something called immunological dark matter that we're not aware of. There might be, let's say, 40 to 50% of our population which is resistant to the disease. So they might never. But I think just a point on opening up. Sometimes I think a change in perspective, as they say, is worth 80 IQ points. You know, so we've been very skeptical about the rapid antigen tests, right? But if you ask me, there's a fundamental distinction between diagnosing an infection and diagnosing infectiousness. And perhaps the only variable that you should control is frequency of testing. So suppose you have a test, that's a paper test, that is available at 50 rupees, that is self-administered at your home every morning, like a drop of saliva onto that. And it can tell you if you are infectious, because it is fundamentally meant to pick up only high viral loads. You can open up. You know, you can, in America, they're talking about daily quick tests. So if you wish to go to school, every kid wakes up, takes this test. If he or she is negative, they go to school. If they're positive, they stay back home. If you're going to a restaurant, perhaps you should. This is a 50 rupee test. In the US, it costs $1. So in India, production dynamics, it can be down to 10 rupees and self-administered. And the report is available in 15 minutes. It's like a pregnancy test. So you have to think on those lines if you're thinking of opening up.
Very interesting. Amit, I'll give you the last word. Do you feel a little better? Where do you see your life going from here?
I mean, I just hope that I get everything back. I mean, I have just few points to the doctors, you know, the experts here. So I have become a 20% doctor of COVID myself, reading so much into it. I mean, according to the ferritin test, to everything, D-dimer, everything. So I'm just asking that why does not the ICMR allow CT value to be put on the test? What I understand is this is a very crucial value as per some doctors. It does give a lot of indication. Most of the countries allow the patient to know the CT value. Why not in India?
So can any of the doctors take that? Does anyone, Dr. Mithal, the CT value?
No, I think the CT value is important, but I don't think it's, you know, there are a lot of flaws in that also. It's not a foolproof test, which is why they may have said that it will be misinterpreted and misused, and maybe that's why they discouraged. So it is good information, but I don't think it's like clinching information in many, and it can be misleading also. That must be the reason. When you use something in public health, you got to be really sure, like the antigen test that Ambrish was talking about.
Yeah. Well, we'll have to leave it there, but I'm actually fascinated by this idea of the 10 rupee or the 50 rupee daily test. And I think we're going to have to embrace a new way of living. Our lives as we knew them earlier may have changed dramatically. But Dr. Oomen John makes the important point about how much we don't know, and research is going to be key. And therefore, we must not make light of the experiences of Amit, of Nitin, and of Neil. Thank you so much to our panel, and we'll keep an eye on this story. Coming up next, tomorrow, we'll be looking at how this is impacting children. I think that is critical to the conversation around schools. For now, thank you very much to our panel, and thank you to our audience for watching.
Thanks.